Good morning, my beautiful train wrecks. How we doing? I can talk. Sorry. Baby's mad because I talked. Which is okay. He'll get used to it. Either way, today we're going to talk about nipple health and breast health while you're nursing. I'm going to touch some key points real quick. Keep your nipples and your breast clean. Wash your hands. Sorry if I keep stopping to soothe. Hey, just because you don't want me to talk don't mean I can't. Okay, back to it. Keep your hands clean, keep your breasts clean, keep your nipples clean. Do not wash your nipples with soap. It can dry them out more. You do not want dry nipples trying to breastfeed. They will crack. They will bleed. Would you not? So now he's just going to talk to us while we film. That's okay. That's fine. Babies do that. Your mama's going to understand. Okay, yep, keep nips clean. Don't use soap on the nips. Next thing, make sure you have a good latch. If you're not breastfeeding and you're just exclusively pumping, make sure your flange size on your pump is a good fit for your breast. You want to make sure it fits. Sorry, I'm using this thing. Trying to collect some milk as I'm feeding. If someone doesn't knock it off. There we go. I'm gonna hide that back in there. Come on. Yeah. Someone got mad at me. He's to the stage where he is distracted when he eats sometimes. Especially if mommy's talking. It's okay though. Okay, point number 2. Make sure your nipples are moistened. I've been told hand express a little bit of milk and rub it on your nipples to help with it, to help soothe dry and cracked nipples. That doesn't work for me, I'm going to be honest. It does not work. So I would recommend nipple butters, creams, gels, whatever works for you, do, because you want to do some preventative. Don't treat, prevent. Use it, regardless if you're pumping or breastfeeding. Use the creams, the butters, the gels, whatever you want to use. Just find something that works for you. Do it before your nipples get cracked. Do it before they're dry and cracked. Trust me, it's much easier. You want to make sure you have a good latch. Thankfully, my little man has finally learned how to latch without my assistance, so I just kind of just let him go. He's going to do whatever anyways, so what's the point of trying to stop him? Just let him go. He latches really good, so he unlatches by himself and latches himself back on whenever he feels like it. Now, for a good latch, you want as much of the breast inside the mouth as you can possibly get. That way your nipple is at the back of their throat, and they're not munching down on it. You do not want them gumming the shit out of your nipple. It hurts like hell. It took quite a while for us to learn how to latch without a nipple guard, and don't feel bad if you have to use a nipple guard. Sometimes a nipple guard is a fucking lifesaver. Let me see if I can find one. I usually keep one under the pillow in case he can't latch on. There it is. Yes, I'm in bed. Why? Because we're being lazy today. Because we're allowed to be lazy. Yeah. Are you not wanting to be on the nip today? I'm not giving you a bottle. You yelled at us for bottles yesterday. We're not doing it today. Okay, this is a nipple guard. Yes, this one needs to be cleaned. We used it last night. There's nothing wrong with using a nipple guard. Sorry, face got cut off. There's nothing wrong with using a nipple guard at all. It's a great tool to use. If your nipples are really sensitive, go ahead and use one. I know a lot of people say, oh no, you shouldn't be using one or they're not made for long term. Bullshit. Use what works for you. If you really want to breastfeed and your little one can't seem to latch, there are many reasons why that happens. Many. There's nothing wrong with using one of these. At all. If anyone says anything to you, tell them to shut the fuck up. Because it is none of their damn business what the fuck you do in the first damn place. But these little things are a fucking lifesaver for me. For the first 2 months, he would not latch. I can get him on, but that's about it. He would not eat. So I had to exclusively pump for 2 months. And I had to also substitute with formula as well, because I wasn't making enough because he wouldn't latch on. But we eventually got that figured out, and I tried to use one of these things, and he latched onto that. And now I got him latching without it. We occasionally use this when I'm too engorged, because that does happen. One of the reasons why your baby can't latch is you might be too engorged. Your boob might be too big to fit in the mouth. It happens. There's nothing wrong, nothing to be ashamed about. It happens. Life happens. Okay, what have I gone over so far? Blah, blah, blah. Clean the nipples. Latching. Nipple butters. Use one of these little things if you have to. Oh, yes. You use, the breast pads. Milk pads. Disposable ones or ones you have to wash. Doesn't matter. Use what you want to use. I use disposable ones mainly because, dear Lord, I'm not changing them 5 times a day and only be able to wash them. No. You may want to sit there and save money and use the same all day long. Don't. If you leak, they get wet, change them. Do not leave extra moisture unless it's the butter or the creams or whatever. Do not leave breast milk on you wet for hours at a time. Do not do that. That's how you're going to get thrush or mastitis. However you pronounce it. You know what I'm talking about. Super painful infection in your breast. It hurts like hell. I've had it. And, ooh. I was in the hospital for 2 days. We couldn't get the fever to break. Little man's gonna talk to us. He wants to be part of the video. Either way. Change your pads often. If you start to leak, go ahead, let it finish. As soon as you're done, change them. You may go through quite a few of them doing it that way, but it is much better than getting thrush or mastitis. Trust me, it is much better than that. That little bit of extra, would you just stay on? That little bit of extra money you're spending on pads is a lot less money than spending a hospital visit or a doctor's visit. Trust me. If you do get thrush or mastitis, you need to see a doctor. And if you have nipple pain or breast pain, consult your doctor. Talk to him. Don't feel bad. Don't feel ashamed. And most people say, oh, if they're latching right or you're pumping, you shouldn't be hurting. Bullshit. Sometimes it just hurts. Sometimes you just get sore. You're not necessarily hurting, but you're sore. Like at this point in time, I'm not hurting. I am sore though. And that's just from him using them. I'm not gonna lie. In a perfect world, it wouldn't be painful. But in all reality, yeah, sometimes it hurts. It hurts if they bite down on you. Sometimes they don't get the best latch. Sometimes you unlatch them and you don't do it right. When you unlatch your baby, don't just pull the boob out. Don't. That hurts like hell and you're going to hurt yourself. Go at the corner of the mouth, pull back, get that suction off. As soon as they lose suction, go ahead and take it out. Break that suction first. Because if you don't break that suction, it's going to hurt and you will crack your nips. Now, if you have cracked nipples and they are bleeding, don't stop using it. Continue to feed your baby. This is from my lactation consultant. This is what she told me. For the first couple weeks, I was having trouble. Because yes, I did have cracked and bleeding nipples at one point in time. Because we couldn't latch right. Continue to feed your baby. A little bit of blood when they spit up. If you know it's yours, it's fine. A little bit of blood on the poop, that's fine. Because they're getting far more milk than they are blood. Far more. I think that's all I got for today. I love you, train wreck mommies. See y'all later. I hope y'all have a wonderful day. I think Lil Man wants to say hello as well. Hey, you gonna say hi? Not really. He just wants to sit here and talk to us, that's all. He just wants to talk to us and someone to listen to him. So, I love y'all. I hope y'all have a wonderful day. Bye.